Hello everyone. In this video, we will learn about antidiarrheal drugs, which are part of the gastrointestinal drug group. Antidiarrheal drugs are divided into three main categories: anti-motility agents, absorbents, and drugs that modify fluid and electrolyte transportation. What is diarrhea? Diarrhea is a condition where a person has loose, watery stools more than 3 times a day. There are two types of diarrhea: watery diarrhea and dysentery. Let's learn more about anti-motility agents. These drugs are also called anti-peristalsis drugs. They work by slowing down the movement of the intestines. This gives the body more time to absorb water, which helps to make the stool more solid. A common example is Loperamide, also known by the brand name Imodium Diphenoxylate. Brand name Diphenoxylate. Loperamide has a stronger effect than Diphenoxylate. In treatment, we need to understand the objective. If we have diarrhea, should we stop it or not? Or, to what extent should we stop it? We also need to know, should we always use antiperistaltic drugs when we have diarrhea? When should we use antiperistaltic drugs? Indications: these drugs can be used for watery diarrhea, non-infectious diarrhea, diarrhea that happens too often, diarrhea caused by food poisoning. Motility diarrhea. Motility diarrhea. What is motility diarrhea? Motility diarrhea happens when the intestines move too quickly. Increased peristalsis, so food and water pass through the gut too fast. As a result, there isn't enough time for the intestines to absorb water and nutrients, which leads to watery stools. Causes of motility diarrhea: irritable bowel syndrome, IBS, hyperthyroidism, diabetic neuropathy. After certain surgeries like bowel resection, infections, or stress. All of this case, we can use antiperistaltic drugs like Loperamide or Diphenoxylate. Slow down the movement of the intestines. This can help reduce stool frequency and give more time for water absorption. Do not use these drugs in some cases. For example, if the patient has bloody diarrhea. Infectious diarrhea is an infant under 2 years or an elderly person over 65, because slowing down the gut can trap harmful organisms inside and make the infection worse. Loperamide can be used under certain conditions. If you have frequent diarrhea, you can use a small dose of Loperamide to help slow it down. However, it should not completely stop all diarrhea, because the body still needs to remove harmful substances, like bacteria or toxins, through the stool. If we trap the bacteria inside the intestines by stopping diarrhea too much, the infection may get worse. The bacteria can spread and lead to sepsis or septicemia, which are serious and dangerous conditions.